Viewer, here on India Today, you always expect real experts, real wisdom, real information and real data. The reason why we've dedicated an entire edition of 5 Live today to the COVID crisis is because of what we learnt 2.5 years ago when China obfuscated all facts. Now we do not trust China, and therefore we need to be doubly, triply, quadruply prepared for what could possibly happen as a spin-off effect of the COVID crisis that's happening there. Remember, one of the most prominent, credible faces during the entire COVID pandemic here in India was Dr. Randeep Guleria, who was at the time director of the prestigious All India Institute of Medical Sciences. He was one of the government's soldiers, as it were, in India's big and in many ways successful fight back against COVID. There have been issues that India needed to tide over, but in many ways India has stood up as a model for the rest of the world. Our health editor Sneha is with me as well. She and her team have been breaking every single story as far as COVID-19 is concerned, and that's the reason why India Today continues to be the most watched channel on this issue. Dr. Guleria, really good to see you in your in your post-retirement avatar, but you're back on the forefront of healthcare in India, and that's the reason why we welcome you onto India Today. We're going to go to Dr. Guleria in just a moment. Before that, here's a report that Sneha brings us today. 3 years on, the novel coronavirus, not novel anymore, is still alive, kicking and causing untold mayhem in the China that birthed the virus. It's seeing the worst crisis in 3 years. Neighbor India is not taking any chances. And today, our Health Bureau analyzes the situation with hard facts. Take a look.
The fear of a possible return of the coronavirus has now got India on a high alert mode. Health Minister Mansukh Mandavia held a high-level meeting to assess the India situation vis-à-vis China and said that COVID is not over yet. The worry? The infectious BF.7 that has been in circulation in China and has surfaced in India as well.
BF.7, the variant that is causing shock waves in China, already exists in India. In fact, it was spotted as early as in the month of September this year, and 3 times in total. But what the government is focusing now is on bringing back the mask mandates in the country. States will be asked to do so, and also looking at an uptick on the precautionary dose.
India is not looking at imposition of restrictions, but has asked for going back to the basics.
आप जब क्राउडेड प्लेस में हैं, अंदर या बाहर, तो आप मास्क करिए, और जो व्यक्ति उम्र में बड़े हैं या कोमॉर्बिडिटीज हैं, उनको तो ये ज़्यादा इसका इस्तेमाल करना चाहिए.
Experts say that surfacing of new variants and infectious sublineages need closer monitoring and sequencing. India has been lax on this front. The Health Ministry has also written to states asking them to ramp up sequencing.
Genome sequencing, on the other hand, is to send these samples to a specialized research laboratory that will look at the genetic makeup of this virus. Thus, they will be able to tell if new mutations have come or if the existing variants have changed.
The Government of India is also now stressing on the need to improve the uptake of boosters, saying that the uptake of boosters is just about 28%, which actually is fairly dismal. Very recently, the Serum Institute of India also spoke about the fact that it had to discard many COVID-19 vaccine doses because there is just no demand.
Particularly जो हमारे citizens, senior citizens हैं, वो कोई छूट गए हैं precaution dose से, तो हमेशा की तरह जैसे हम पहले भी अपील करते थे कि उनका हमें ज़्यादा ख्याल करना है. सीनियर सिटीजन्स क्योंकि वल्नरेबल हैं और बीमारी वाले व्यक्ति वल्नरेबल ज़्यादा होते हैं.
What the actual virus currently circulating is, whether it is a previously confined ancestral virus or a Delta variant, or is it from the Omicron family of variants which are currently the dominant viruses in the world for COVID. Based on that, we'll have to judge what the likely dangers are to both to China and to the rest of the world.
While China's situation is different from India and the rest of the world, the China crisis shows us that this virus that has the potential to cripple the world is alive and kicking even 3 years after it first raised its ugly head. With Milan Sharma in New Delhi, Sneha Mordani for India Today.